Good afternoon, everybody. Welcome to all of our friends from Raez. My name is Raez. I'm a medical director of Memorial Cancer Institute. It's part of the Memorial Healthcare System. It's the public healthcare system here in Broward County in South Florida, close to Miami. It's my pleasure to discuss today artificial intelligence in lung cancer. There are tons of applications of artificial intelligence. So today, in this short talk, we're going to focus or base our discussion in the applications for lung cancer screening. Starting with the topic, lung cancer screening, it was validated in 2011 when 50,000 people studied in the United States show a reduction in mortality of around 20%. 20% very important because this benefit and reduction in mortality is larger than the reduction in mortality that you have with other screening methods that we're used to, like mammogram, pap smear, and colonoscopy. Unfortunately, it was not implemented because it took many years before we start to get reimbursed for this service, for this screening. So probably the last 5 years, around 2018, we start to get reimbursed. And now, in 2024, between 6 to 10% of Americans only are screened for lung cancer, meaning that we have to screen 15 million Americans and only 6 to 10% of these populations are screened, because one of the problems of screening, obviously the main problem is, remember, we are cancer doctors, the patients are not with us. These are healthy individuals that are more than 50-year-old. They have been smoking for more than 20 years, and they have quit smoking in the last 15. So these individuals need to be identified by the primary care doctor or the family medicine doctor, and they need to be referred for screening to our hospitals or cancer centers. That's when we have the opportunity to meet these patients, if they become patients, and enroll them in our programs. And that's the major challenges that we have. So one of the solutions that we have found is what we call the pulmonary nodal programs, or incidental pulmonary programs. This is a different program we call IPN, Incidental Pulmonary Nodal Program. Basically, what we do is we have discovered that in our hospitals or cancer centers, every week, we do a lot of CAT scans of the chest for reasons other than cancer. For example, if you come with chest pain to the emergency room, you come with a car accident, you come after a trauma, or you have suffered an assault or any other type of accident at home, you need a CAT scan of the chest. And most of the time, fortunately, everything is well, you don't have a heart attack, you survive the car accident, you survive the traumatic lesion that required the CAT scan evaluation, and you are sent home, and you are happy. However, the emergency room doctor tells you that there is a incidental, not expected, nodule in your lung, and you need to follow up with your primary care. We know by statistics that very few patients follow these nodules, and these nodules are going to become cancer one day. Well, not all of them, some of them. So that is where we found years ago the opportunity to make an impact. So there are millions of nodules found in CAT scans by chance, incidental nodules. So that comes the opportunity to find which ones are relevant, which ones are lung cancer. So we started to do this some years ago in many cancer centers in the United States, and it became overwhelming for our nurse navigators to be checking. For example, in my healthcare system, we do 300 CAT scans of the chest a week. And it was overwhelming for the navigator to check all of these results, to classify the nodules based on criteria like Mayo Clinic or Frazier, which one are high risk or low risk, which ones need to be followed up, which ones don't need to go follow up, and call the patients and then enroll them in our lung cancer program so we can follow them every year. Remember, screening is not only once in a lifetime, you need to repeat every year. So that's why artificial intelligence comes as a solution. We are very fortunate that in the United States there are several companies that develop software for artificial intelligence, so they can create algorithms that can help us to do the classification of these pulmonary nodules in high risk, low risk, which ones we need to follow, which ones we need to enroll, and which ones are not important. so we don't have to waste time in this. So that's why there are several companies, and I'm going to advertise any of them. For example, in my healthcare system, we acquired one of these softwares, and we were able to classify the nodules. So our lung cancer navigator now knows what nodules are high risk, and she needs to call these patients, enroll them in the program, and start a year follow-up until we discover the lung screening. Or in the patients that are very high risk, we need to start the workup and refer them to the pulmonologist or the surgeon, and CAT scan, PET scan, EVAS, all the workup necessary to diagnose or rule out lung cancer. The experience has been amazing. For example, it's well known the experience on Leahy Clinic in the Northeast United States. It's well known the experience of Baptist, Tennessee, with my friend Ray. Here in South Florida, we were able in the last 2 years that we implemented the program to diagnose 10 times more lung cancer are diagnosed thanks to the artificial intelligence software that can detect all of these pulmonary nodules and help us identify lung cancer patients that were not being able to be found by screening. So that is why we believe that this is a complement to our lung cancer screening program. It's a great complement, as you can see, because of the numbers. And because, as you know, not everybody that also develops lung cancer has been eligible for screening. No? For example, there are 30,000 non-smokers in the United States that don't qualify for screening. But anyway, so this is the idea to talk about the use of artificial intelligence. There is a cost for this, but this is a great investment, because if you think about once that we identify the pulmonary nodules, patients need, high-risk patients need CAT scans, PET scans, bronchoscopies, biopsies. We find the lung cancers, they need now surgeries, they need adjuvant therapy, chemotherapy. So there is a downstream revenue that comes from all of these diagnoses of cancers and the workups that easily pays the small investment of buying a software of artificial intelligence and have 1, 2, 3 navigators that can work with the software and run these programs. That's why this is a practical utility, how artificial intelligence is making a difference in our lung cancer world. Thanks for your attention.